All right, so today we're going to cover the fat-soluble vitamins in Chapter 12. We know vitamins help give us energy, but do they give any kilocalories for energy? No. So we know no kilocalories, but B vitamins act as coenzymes, so we need them for energy metabolism. Okay. So we know they are organic, meaning they have what? If we say that something is organic, it means it has what? Carbon and hydrogen, yeah. And we can have both deficiency and excesses, okay? That's how they got classified. So, again, we say that they're essential because they have to be provided by the diet. However, there is a vitamin actually there's two vitamins that we can make. Can you think of any vitamins we can make in our bodies? Can you think of any sunshine vitamin? Anyone ever heard of the sunshine vitamin? Vitamin D, if we get out in the sun, we can activate. But if we're not out in the sun, right, then it becomes a vitamin because our skin, we can't make it if we're not out in the sun. And the other one is vitamin, well, actually there's a third one too. Can y'all think of any other vitamins we make? Anyone know? Vitamin K is made in our large intestine by the bacteria. Did y'all know that? Yeah. We make vitamin K, and biotin's another one. So precursors, also known as provitamins, like vitamin D, that becomes active once the liver and kidney add a hydroxyl group to it. It starts in the skin. All right, so being organic, some can be, when they expose them to light, cooking, and storage, they can degrade. That's why if you hold something in the fridge too long, like your orange juice, your vitamin C content's probably pretty low, especially if you don't cover it. Oxygen can really degrade vitamin C. So you want to always cover things, not use much water when you're cooking, and try not to use long times in cooking and storing. Okay, so again, use a microwave, steam, small amounts of water, and save the cooking water. All right, so now we're going to go into the water-soluble and the fat-soluble vitamins. So you see our list of fat-soluble vitamins, A, D, E, and K. If you want to write a word with it, I couldn't come up with a good word. I put K-A-D-E, Cade. I don't know if that's helpful. So when they were first discovering vitamins, they were giving them letters. And then once they got into the B complex, they realized, wait a minute, we can't give them just letters. There's multiple B vitamins. And so then they gave them numbers to go with them, and then even names like folate. So at first, the alphabet thing was working out. Some of the first research with vitamins they were doing, they started noticing deficiencies. We talked about scurvy, the sailors that traveled around the ocean, and once they were gone, they only had salt meat, they developed scurvy. Also, they found that chicks, if they had refined grains, would also develop deficiencies. And so they continued on, and this kind of helped them identify some of the needs and necessities for vitamins. We know without vitamin A, it contributes to blindness. And so early research with the vitamins started identifying the properties. Okay. So we see our fat-soluble vitamins and our vitamin C, our water-soluble vitamins, and our B complex. What do you think water-soluble means? What do you think that means? Water-soluble. Water-soluble versus fat-soluble. What do y'all think? Water-soluble means it dissolves in water. Fat-soluble means it dissolves in fat. All right. So we absorb our water-soluble vitamins like we do our water-soluble nutrients, right? Like amino acids or our monosaccharides. And we absorb our fat-soluble vitamins like we do our fats. Do you think you need fat to absorb your fat-soluble vitamins? Yeah. So if you have a low-fat diet, are you going to be able to absorb fat-soluble vitamins? No. And so that's where deficiency sometimes can happen with those. The bad thing about water-soluble vitamins, we don't store very much of our water-soluble vitamins except for vitamin B6. And so therefore we excrete a lot of what we don't need, and we need it more often. Versus fat-soluble vitamins, a lot of these we can store, especially in our liver, and we can have several months worth of, for example, vitamin A, without even consuming vitamin A. So the fat-soluble vitamins we tend to store, the water-soluble vitamins, not so much, except for vitamin B6. Okay, so you see our list of vitamins on page 404, our fat-soluble vitamins, our water-soluble vitamins, and you see our list. Remember thiamine, riboflavin, niacin, B1, 2, and 3 is their other names. Pantothenic acid, biotin, folic acid, also known as folate, B6 and B12, and then good old vitamin C, also known as, what's the other name for vitamin C? Sorbic acid. Sorbic acid, okay? So again, the water solubles travel in the blood. Fat soluble also carried in the blood are attached to a protein to be transported to the cells. Okay, so again, they're absorbed with fats, carried in the lymphatic system like fats, and then transported in the blood by a protein carrier. And then toxicity we talked about already. Our fat-soluble vitamins are, again, the ones that we really can get up to toxic levels pretty easily. And then B6 and B12 sometimes can also have some toxicity. B6 in particular because it causes nerve damage. A long time ago they said the B vitamins cause no toxicity. You can have as much as you wanted. And then they started giving people supplemental B6 and they had permanent nerve damage. And they're like, oops, we better not back this thing up. Alright, so you see the upper level intake. Alright, people who are prone to vitamin deficiency in America, alcoholics, and we talked about that, poor and incapacitated elderly, those with serious diseases or those that affect absorption, like cystic fibrosis, for example, celiac disease, and then children, right, if they're not getting adequate care. All right, so again, we've talked about celiac disease and Crohn's disease, which is a GI issue. You know what cystic fibrosis is? Does anybody know how that works? All right, so it causes excess mucus production, both in the GI tract and the lungs. So most people think about cystic fibrosis and the patient not able to breathe and the issues with the lungs, but it also affects the digestive tract, so they're not able to absorb as much nutrients. So often they'll need IV or supplemental nutrients, sometimes with night feedings with cystic fibrosis. And if they don't get enough nutrients, it'll really affect their overall health and, of course, their ability to grow. So you'll see this one sometimes. Fat-soluble vitamins, again, when we cook them, they're more stable than our water-solubles. For example, you can cook your carrots, which are also a source of vitamin A, and vitamin A is still there. But they are lost when we take mineral oil. Also, if we have patients who are taking cholesterol-lowering medications, it will affect your fat-soluble vitamins. Okay, it will lower your fat-soluble vitamins. So I had a family member taking cholesterol-lowering med. Excuse me. And it lowered her vitamin D, and the doctor told her, your vitamin D levels are too low. And I'm like, no wonder. You're taking this cholesterol-lowering meds. Of course they're going to be low. All right, so now I had a think time question. Where's my think time? All right, let's do a quick think time. So list the fat-soluble vitamins and list the water-soluble vitamins. List the fat-soluble vitamins and list the water-soluble vitamins. And if you need some help, it's on page 404. So list the fat-soluble vitamins and list the water-soluble vitamins. Page 404. List the fat-soluble vitamins, list the water-soluble vitamins. So list the fat-soluble vitamins and list the water-soluble vitamins. And this is on page 404. right, next question. How do they differ in absorption? How do they differ in absorption? And which group do we store more of? Which group do we store more of? How do they differ in absorption, and which group do we store more of? Which group do we store more of? Alright, so let's go into vitamin A. Vitamin A is also the class known as the retinoids. We'll talk about those here in a second. And vitamin A, they determined the function of vitamin A some time ago because, again, one of the first symptoms of vitamin A deficiency is what? Night blindness. And so we know that vitamin A is very important for vision. Okay. Other roles of vitamin A is for healthy skin and all the epithelial cells in the body, including those in the skin, also those lining the respiratory tract, the digestive tract, require vitamin A. Okay? So if we don't have adequate vitamin A, we're not going to have healthy epithelial cells. They're also known to help and necessary for bone growth, reproduction, and for a healthy immune system. Okay? So other sources of vitamin A that come from vegetable source. So when we talk about the majority of vitamin A's in foods are coming from animal sources, including liver, fish oil, fortified milk, and margarine. But we also can get vitamin A from orange and green stuff. Okay, things like carrots, sweet potatoes, pumpkin. The beta carotene can be converted into vitamin A. Okay, spinach. The beta carotene, again, in these vegetables can be converted to vitamin A. So a lot of people, if you're vegetarian, do you think you can get enough vitamin A? Sure. Yeah, you can get it from your plant sources of your greens and your orange-colored foods. Okay. So we see the class of retinoids, and we see their names: retinol, retinal, and retinoic acid. Each one of these forms have different roles in the body. The retinol is very important for vision. Then we talk about retinoic acid in epithelial cells, and also playing a role in helping protect against cancer. And vitamin A deficiency worldwide is one of the most preventable forms of blindness. So people go blind in other countries where they don't get adequate vitamin A. So let me use an example. For example, in places in Africa, they have blindness, even some of the Asian countries, especially with children, because even though we can store vitamin A, in children the stores aren't enough to carry them through. So maybe during mango season they're eating a lot of mangoes and getting a lot of vitamin A from beta carotene, but they're not able to store enough to carry them through the whole year, and so they can start to have some of the issues with eyes, and especially both on the surface of the eye and also in the retina, where we have our photoreceptors of the eye for vision. Okay, so big worldwide issue. And then toxicity with abuse of supplements. Okay. And then we have a protein that carries vitamin A in the blood, and it's called retinol binding protein. All right, so that's just showing you the different roles of the retinoic acid, retinol, and retinol. All right, so the cornea is the clear part of the eye. So again, those epithelial, it helps to maintain it. If we don't, then we'll start seeing drying of the cornea, and this also will contribute to blindness as well as in the back of the eye on the retina. So let me show you what that looks like. All right, we talked about epithelial cells on the skin. So another symptom of vitamin A deficiency in the skin is very, very bumpy skin issues. There's a good picture in your book. Hang on, I'll show you a picture. I thought it was in our book, but it's in my notes, so hang on. This is showing you what happens to the epithelial cells. All right. And then we talked about reproduction, both sperm development, fetal development, and growth in children. All right. Hang on, let me show you this slide. All right. So we see hyperkeratinization, a symptom of vitamin A deficiency. Now, I don't know if you can see all those little bumps. That's a characteristic symptom because, again, these epithelial cells aren't turning over normally. Okay. And then let's take a look at the eyes. So the epithelial cells, the conjunctiva on the surface of the eye, you develop these foamy spots. And then the cornea starts to harden, and this disease condition is called xerophthalmia. So light can't enter that cornea. And then, of course, on the back of the eye, it also affects the bleaching reaction of the rod cells in the back of the eye and the retina. So you can see how then vitamin A deficiency can contribute to blindness. Again, one of the most preventable forms of blindness throughout the world, just from not getting enough vitamin A. And so this is the first symptom of what it'll look like, so night blindness, where the eyes can't recover from the dark room. And in fact, in a lot of countries where they have a lot of vitamin A deficiency, they call them chicken eyes because at night, chickens can't see at night and run into things. That's what happens with vitamin A deficiency. Okay. All right, so we talked about those. We'll go to the next one. And then there's been some important research they've done with beta-carotene as an antioxidant to help protect against cancers. They know if we eat a diet rich in fruits and vegetables, we may not develop cancer, and they thought it was going to be beta-carotene. So they extracted beta-carotene and gave it to people as a supplement, and they had to stop the study because the smokers who had beta-carotene supplements developed more cancers than those who didn't. So they had to stop it. So, naturally occurring, perhaps, but not as a supplement. So they no longer even recommend beta-carotene supplements at all. Okay. All right, so we talked about it takes a while to develop vitamin A deficiency. But if you have low vitamin A stores, it impairs a child's immune system, and we see this globally, not so much in the U.S., but it could happen. And so if a child has something like measles, which is pretty common globally, then they may pass because their immune system becomes compromised. They've also been looking at vitamin A and HIV/AIDS too. That's kind of another thing they've been looking at. But again, this is globally. Okay, so we talked about the cornea becoming dry. The term we didn't talk about it's called xerosis, when that cornea becomes dry and hardening, and then keratomalacia once it becomes soft and damaged. Okay, we've already done this. We got a slide shorter, so I'm go back through. And so we see that toxic effects of vitamin A is on page 413. You can see the first symptoms again, night blindness, and then that can contribute to blindness, and then reproduction, we talked about that, and immune function. But then on deficiency symptoms, and then we get into toxicity, we can see the first signs are GI distress, dizziness, muscle incoordination, and then chronic can lead to causing the liver damage, because again, that's where we store liver. They started seeing liver toxicity issues with people eating, because liver is such a good source of vitamin A, that other animals also store vitamin A in the liver. So like people in Alaska that were eating a lot of polar bear livers, they were starting to see symptoms of vitamin A toxicity. Okay? So if usually we don't see it if you eat enough foods. We mostly see it with supplements. And then, again, it can cause birth defects and become a tetragen if you're pregnant. There's also something that people use to treat acne called Accutane. And this Accutane is made from vitamin A. It's not vitamin A, but it's analog of vitamin A. It itself can become a tetragen. So before a woman becomes, or if she's going to use Accutane for acne, they'll test her to see if she's pregnant, and lots of times they won't give it to females because it can cause birth defects. Okay. All right. So what are the three names for vitamin A? Because we've already listed the fat-soluble vitamins. And what are good food sources of vitamin A? All right. So the food sources are on page 408, and the other names for vitamin A are over on page 406. So 406 and 408. So what are the three names for vitamin A, and what are the food sources of vitamin A? Because we've done that first one already. So what are the three names for vitamin A? What are the food sources of vitamin A? And then I should give you one more. What is the name of the plant source that can be converted into vitamin A? What is the name of the plant source that can be converted into vitamin A? The last one. What is the name of the plant source that can be converted into vitamin A? So what are three names for vitamin A, food sources of vitamin A, and what is the name of the plant source that can be converted into vitamin A? And I was going to mention something on that last one. What did y'all get on the last one? What is the plant source of vitamin A? What do we call it? Is it called what? Go for it, go. Not quite. Not quite. Almost, yeah. What'd y'all find? The plant source? Beta carotene, yeah, that we can find in orangey, right? Orangey vegetables and some fruits, and also can be found in greens, right? It's also found in greens. The chlorophyll hides the beta carotene. One of the things I was going to mention, our body only converts the beta carotene into vitamin A that the body needs. So globally, to prevent vitamin A toxicity, there's not always good public records in like a developing country, and they're trying to supplement with vitamin A. So because they're afraid to give too much vitamin A, what do you think they give them? They give them beta carotene, because your body only converts what it needs. But however, this is something you'll see with little kids, little babies. If you feed them a lot of sweet potatoes, pumpkin, or carrots, anyone ever seen a baby's skin turn orange? So I had a little niece, and she was real fair skinned, and she only loved sweet potatoes and carrots was her favorite thing when she was little. The end of her nose grew orange. Under the skin, it was just orangey as can be. All right, that's called hyperkeratinemia, but it's not toxic. It just looks weird. She had a little orange nose. It was really cute, but yeah, it was orangey. So you will see that from eating a lot of beta carotene, but your body only converts what it needs. Okay, so that's cool. All right, we talked about the upper level intake for vitamin A is 3,000 micrograms per day, and we didn't talk about that. Okay. I'm sorry, that was beta carotene. This is RDA for vitamin A. All right. And so I always think about Thanksgiving where we get sweet potatoes, get all the green stuff, and pumpkin pie. So vitamin D, your body can make with the sunshine if you're out in the sunshine. So if you're light skinned, 15 to 30 minutes. If you're dark skinned, do you think it's going to take longer? Yeah. As you get older, it's not as active. The enzymes aren't as active. So we see a lot of older people with vitamin D deficiencies. So now some doctors are starting to recommend vitamin D supplementation. Okay. Other names for vitamin D, calciferol is the other name, or 1,25-dihydroxy vitamin D, calcitriol. So kind of weird when you look into these chemical names. Okay. So once it starts in the skin, but the kidneys and the liver add a hydroxyl group to activate vitamin D. So vitamin D is not activated until the kidneys and the liver activate it. So what if the patient has liver failure? Can liver failure contribute to vitamin D deficiency? Yeah. Can kidney failure contribute to vitamin D deficiency? Yeah. So either one can affect vitamin D status. All right. So sources of vitamin D. It's in fortified milk. We talked about that. Milk is fortified with A and D. Even the soy milks and things, butter, margarine. Now they put it in cereal. And then other places are the fatty fish, like sardines, herring, liver, and it's also in eggs. So if you eat eggs, you get some vitamin D. All right, so there's the sources you can see. And that's just showing you activating vitamin D. So again, starts in the skin, liver adds a group, hydroxyl group, and the kidneys add the last hydroxyl group. All right, so now let's do a quick think time. You guys ready for your think time? Mm-hmm. All right. So how does vitamin D become activated? Or maybe we should just do which organs. Which organs activate vitamin D? Which organs activate vitamin D? Which organs activate vitamin D? And 418 if you need some help. Vitamin D. Yeah. Which organs activate vitamin D? So if you're on page 418, So one of probably the most important roles of vitamin D is to enhance the absorption of the minerals calcium and phosphorus. So without vitamin D, are we going to be able to absorb enough calcium or phosphorus? No, we're not. And so it's under hormonal control. And so the hormone that helps to regulate our calcium level in the blood is parathyroid hormone. And so behind the thyroid gland, there's 4 little glands called the parathyroid gland. And this hormone is released when the calcium levels drop. Right? So when our calcium levels go low, then it causes the increase of parathyroid hormone, which then will tell the kidneys to reabsorb calcium and our intestines to absorb the calcium. And if we're not getting enough in our diet, then it will cause the release of calcium from our bones. But all to help our calcium, to keep our calcium in a really normal level. So without vitamin D, then we're not going to be able to absorb enough calcium. It'll get excreted out. And so then with children, we can develop the disease condition without enough vitamin D we call what? You guys know what that's called? Rickets. Yeah, let me show you what that looks like. Let's go right to the picture of rickets. All right, there's rickets. See all the little bowed legs? And also you see the little beads on the chest. We call it rhoetic rosary beads. So without adequate vitamin D, they're not going to be able to absorb enough calcium. And then the bones become very weak. And these are the little developing children. And their legs will bow under the weight. All right. We used to have a lot of it in America. We don't see much of it anymore. In countries where they cover up, especially like the women and the children, they cover their faces, their heads, and their body. They're not getting adequate sunshine, or they're not getting vitamin D in their diet. They're starting to see some rickets. Okay, so again, it also causes the fontanelles, incomplete closure of the fontanelles of the cranial bones, and can affect the development of the skull cap. Okay, so you can see, whenever I think of vitamin D deficiency, I think of rickets. That's the number one thing I do. I see. I know, it does kind of sound like it. Here it is. In adults, the disease condition is called osteomalacia. So we often see this one in women who have a lot of babies back to back. And the bones become very brittle. They have a lot of bone pain, a lot of bone weakness. Okay? So it's called osteomalacia in adults. Okay? If you're ready for the next one. Because you know it. All right, so what are the deficiency diseases of vitamin D in children and adults? So what are the deficiency diseases of vitamin D in children and adults? And if you need help, 420. So what are the vitamin D deficiency diseases in adults and children? Alright, so we talked about vitamin D is important for bone development and bone growth. We also need these vitamins to help to maintain bone strength, vitamin A, C, and vitamin K. And then we talked about the parathyroid hormone. Calcitonin is a hormone too, but it helps to lower calcium. In children and pregnant ladies, it helps to move calcium into the bones. And we also have the minerals calcium, phosphorus, magnesium, and fluoride that makes our bones strong. And then the protein collagen. Other roles of vitamin D in the body. This is one that's kind of like real popular. A lot of people are doing vitamin D to help prevent certain types of cancer. Okay, so it acts like a hormone effect in the body, and so can play a role boosting the immune system. And they now think that vitamin D deficiency may be associated with MS, multiple sclerosis. So people who live in northern climates are seeing more MS than those in southern climates. So they think it may play a role. Also plays an important role in brain nervous system development And then you see some other organs such as pancreas, skin, muscles, and cartilage. We talked about vitamin D deficiency. When mothers are breastfeeding, breast milk is low in vitamin D. The babies will need supplemental vitamin D. And if you're not getting fortified milk, you're not getting adequate vitamin D, or if you're not drinking milk. So that's why they started putting it in kids' cereals. All right. And we'll talk a little bit more about calcium, and we'll talk more about osteoporosis a little bit later. We're seeing a lot of elderly people with vitamin D deficiency, and they think this may increase their risk for lots of diseases, especially certain types of cancers. All right, vitamin D toxicity. Again, this is one a lot of doctors push vitamin D. We have a doctor in town. I'm not going to say his name, but he did say everyone needs a lot of vitamin D. And I went and saw him one day, and he was pushing vitamin D on me, and I said, you know vitamin D can become toxic. And he said, no, vitamin D can't be toxic. So I said, yes, excessive amounts of vitamin D will cause excessive amounts of absorption of calcium, and it'll cause calcification of your organs. He goes, really? And I'm like, really? Yeah. So you really want to be careful, right? And so I know there are people who kind of have low levels of vitamin D, but, you don't want to take too much. Again, it's very toxic. So the upper level for adults is 50 micrograms per day. And high blood calcium is called hypercalcemia. And again, this is often due to excess vitamin D and too much vitamin D when you're taking supplements. Hypervitaminosis, vitamin D. All right, so let's talk about something. So if vitamin D is the sunshine vitamin, can you get too much vitamin D activation when you get a sunburn out in the sun? You think so? You think your body's going to let you do that? No. That's the thing. Nope, your body only makes what it needs. Nope, you're not going to get... Can you get too much from a tanning bed? No. Your body only makes what it needs. Okay? So these are recommendations, and they kind of upped it a little bit on some of the older adults to 15 micrograms per day. Okay. And that's just showing you that people in northern latitudes aren't getting enough vitamin D activation. All right, here we go. What are the signs and symptoms you expect to see with too much vitamin D? What are signs and symptoms you expect to see? We did the too little already with children. And what are food sources of vitamin D? We didn't do that one. All right, and so food sources are on page 416. Signs and symptoms for too much vitamin D and the food sources. We did the too little already. What are signs and symptoms you see with too much vitamin D? What are food sources of vitamin D? We did the second one already. We looked at deficiency. Next question. Would you expect to see a kidney patient with vitamin D deficiency? Would you expect to see a kidney patient with vitamin D deficiency, and why? Would you expect to see a kidney patient with vitamin D deficiency, and why? Would you expect to see a kidney patient with vitamin D deficiency, and why? Would you expect to see a kidney patient with vitamin D deficiency, and why? Alright, vitamin E is on page 422, and its other names are tocopherol. So you'll see names like alpha, beta, gamma, delta, tocopherol. So when you think of tocopherol compounds, sometimes on a vitamin label it'll say tocopherol, okay? So again, that's vitamin E. Vitamin E is an important antioxidant that's necessary for our plasma membrane to protect our plasma membranes of our cell. It also helps to protect the polyunsaturated fatty acids and vitamin A, and prevents the oxidation LDL. They used to look at vitamin E to help protect against heart disease. They thought people who took a lot of vitamin E supplements, if they were at risk for heart disease, might help protect them against oxidation of LDL cholesterol, but they haven't found any benefit from that. So heart doctors used to recommend it a lot of times. So when you think of vitamin E location in foods, I always say oily, right? Oily for vitamin E. So you think of the oils. So the vegetable oils are your best source of vitamin E. So anything vegetable oils are in, you're going to usually find vitamin E. Things like salad dressings and mayonnaise and so forth that contain vegetable oil. So oily is your key right there. And then, of course, we see our nuts, which also are loaded with oils. Okay, so great sources of vitamin E. Usually the only time we see a vitamin E deficiency is in premature infants, and they can develop something called erythrocyte hemolysis. What do you think? Erythrocyte, when you see the word erythrocyte, you think of what? You see the word erythrocyte? Those of you in anatomy, I don't remember that one. Does that sound like red blood cells? Erythrocyte means red blood cell, the same name for red blood cells. Hemolysis, lyse means to split, cut, yeah. So it means the red blood cells rupture open, and it can lead to anemia. So it's called hemolytic anemia. So without vitamin E, the plasma membrane of the red blood cells becomes very fragile, and they rupture and burst and leads to anemia. Okay, so again, we don't see it a lot. If you're on a low-fat diet, you might develop vitamin E deficiency, and usually you're going to see the dry skin and hair as a typical symptom, but we don't often see the hemolytic anemia like you do in premature infants. All right, so you ready to go? So what are the vitamin E deficiency disorders? And it's on page 425. What are deficiency disorders with vitamin E? All right, you ready for the next one? What are food sources of vitamin E? I gave you a hint a while ago, right? I don't know, sometimes it helps to get something easy to remember. You get a lot when you start getting into these vitamins and minerals. Food sources of vitamin E. And on page 424, just FYI, it shows a list of antioxidants to help protect our cell membranes. and our cells from oxidative damage, both inside the cell and outside the cell. And so you'll see vitamin C, and vitamin C helps regenerate and plays an important role protecting vitamin E. But you'll see things like glutathione, peroxidase, catalase, and the other ones. They think these may help play a role in helping cells, preventing cells from becoming altered and contributing to cancer. So for a long time, they were giving people in studies vitamin E and vitamin C to see if it helped prevent certain types of cancers. They haven't seen a result from that, so they've quit doing those studies now. Okay, and then we talked about supplements does not prevent or cure muscular dystrophy. Vitamin E toxicity, however, they set the upper level at 1,000 milligrams a day. Heart doctors were given huge amounts of vitamin E a long time ago to help prevent against LDL oxidation. And excessive amounts of vitamin E can result in hemorrhaging. So do you think the patient taking vitamin E before surgery would be good? No. It also interferes with anti-clotting medicines, like Coumadin, warfarin, some of those anti-clotting medicines. So, and again, vitamin E, we haven't talked about vitamin K yet, but vitamin K is important for blood coagulation. So if they're taking too much vitamin E, it can interfere with the action of vitamin K for blood clotting. So again, vitamin E, they're really backed off of because too much, you really run a risk with patients hemorrhaging, especially if they have to go in for any kind of surgery. And the RDA for adults is 15 milligrams a day. Most of us get that with our diet. Okay, and we talked about all the good sources. All right, we've already done that one. I'm not going to do that. All right, vitamin K. You see the chemical names of vitamin K: phylloquinone, minoquinone, minodione, and then naphthaquinone. Don't you like to say those 5 times fast? So the quinone family of vitamin K. The cool thing about vitamin K, what do we say about it? Do you have to take it in your diet? We can make it, right, in our large intestine, our bacteria. But people who take a lot of antibiotics will kill out the bacteria that make vitamin K. So people doing antibiotics will need vitamin K, okay? And we have to have it for blood clotting. And without vitamin K, it will cause uncontrolled bleeding. So let me show you. Little newborn infants, and before we get to that one, when you think of vitamin K, think green. Vitamin K equals green. I like it that the bars are green, right? So the greens are some of your best sources of vitamin K. Vitamin K is in other things too. Canola oil, soybean oil, to name a few. But the greens are some of your richest source of vitamin K. All right, so we have to have it for blood clotting. It's also important for bone health. That's one of the new findings of vitamin K. It's important for bone health, for those bone proteins. And so you can see the role of vitamin K. There's a whole lot of factors, including calcium for blood clotting, but vitamin K helps to activate those clotting factors. All right, this is my favorite picture on vitamin K, because you can see newborn babies, their GI tracts are sterile. And so they give them a source or a dose of vitamin K when they're born, either a shot or an oral form, because if they should have any kind of bleeding event, they would not be able to clot. So within 6 hours after birth, they give them a shot of vitamin K, or you can see the oral dose. Some of you might have noticed that. You've ever seen newborn babies, all right? Because again, without it, they won't have enough to prevent blood clotting. Now, this is an issue with vitamin K, with people taking warfarin and Coumadin. Anyone working with older people who's taking warfarin, Coumadin, and those blood thinners, if they're taking blood thinners, they have to take the same amount of vitamin K in their diet as always. They can't alter the amount of vitamin K in their diet. So let's back it up a little bit on the dietary sources. Let me show you a picture. Oh, there's the picture. All right. So we see the greens in particular are loaded with vitamin K. So say you had an older person, they're taking blood thinners, and they decide they want to go get everything out of the garden and go crazy, like cabbage, kale, whatever. Is that going to mess up their dosage of the medicines? Big time, big time. So when you're working with patients, you always tell them you can only eat the same amount as you've always eaten. So if they ate cabbage every day, continue eating cabbage. That's how your dose is set. If you can't just decide you want to just binge out on spinach or kale or whatever. It's very important for people taking blood clotting drugs. Or blood thinning drugs, blood thinning drugs. Very important. And you'll see a lot of questions on that when you get into nursing and other ones. All right, so other programs, especially nursing. Big deal. All right, vitamin K toxicity. No known toxicities right now, but then we talked about the role of anti-clotting meds. All right, AI, and we've talked about sources. All right, here we go. So what are deficiencies of vitamin K, and what foods are needed for vitamin K? So again, on page 426. And how can antibiotics, this is your next question, how can antibiotics affect vitamin K status? How can antibiotics affect vitamin K status? It's our last think time of the day. How can antibiotics affect our vitamin K status?